diet, about their physical activity, about the way that they live their lives. We think that wearables are a key to the MAHA agenda, making America healthy again, and we are going to, my vision is that every American is wearing a wearable within 4 years.
Thank you, Mr. Secretary. Following up.
In Westchester Putnam County at a Riverkeeper event. And I remember back then you talking about the importance of science and environmental action at that time. Listening to a lot of your discussion and a lot of the messages that you provide to people, you talk a lot about corporate influence and corruption in government. And this is an area that's very important to me, and it's an area that I do a lot of work in. I am, as a public servant, completely financially divested of any conflicts of interest with any healthcare companies, any stocks, any lawsuits that I would financially benefit from. Are you?
Yes.
You're completely divested?
Yes.
You have no financial interest in any lawsuit, crypto, none of that?
No. Oh, okay. Crypto? I own Bitcoin.
Okay. And do you have any other securities or assets?
I don't. I mean, I had to go through this with the Office of Government Ethics, and I had a few interests that were very minor that I divested.
Okay, just checking. I'd always like to.
No, it's a good question.
I always like to know what the field is before I enter conversations. So thank you for that. In the healthcare space, something that we've both spoken to is that some of the worst actors are in the for-profit medical space. Are in for-profit health insurance, big pharma, et cetera. And one of the worst companies, actually, is United Healthcare in this respect. United Healthcare is the largest health insurance company in the country. They are the largest employer of doctors and own thousands of pharmacies, clinics, surgery centers, and home health agencies, as well as hospice providers. Secretary Kennedy, are you aware that President Trump's Department of Justice is reportedly investigating United Healthcare for criminal insurance fraud in some of their for-profit health insurance plans, like Medicare Advantage?
I'm not aware of that investigation.
You are not aware that the Trump Department of Justice is investigating the largest insurance company in America that...
No, I'm not aware of...
For fraud in Medicare Advantage?
No, I'm not aware of that.
That you have jurisdiction over?
It doesn't surprise me.
Okay. In your submitted testimony, you said HHS takes seriously our role as responsible stewards of taxpayer dollars. Are you aware that for-profit insurance corporations like United Healthcare have been found to be defrauding public dollars of more than $80 billion a year?
I'm not aware of that number, but
I'm
aware that there's fraud across the for-profit sector.
Respectfully, Secretary Kennedy, if we're making decisions around waste, fraud, and abuse, this is the largest source of waste, fraud, and abuse of public dollars in the public insurance space.
Did you say $80 million?
$80 billion a year.
Did you say 80 million or 80 billion?
80 with a B. Billion.
With a B.
Yeah. If that's the case, why did you nearly double the rate that taxpayer dollars give for-profit insurance companies like United next year, if you don't know those things?
Double the rate? How did I do that?
So your agency nearly doubled the taxpayer dollars that for-profit insurance corporations like United will be paid next year, meaning these companies, the largest of whom is under investigation, criminal investigation by the Trump administration, will be receiving an additional $25 billion from your agency.
How is that happening?
I would be happy to submit to the congressional record evidence of this. I will enter the CMS press release from April 7th of 2025 into the record, which states that Medicare Advantage corporations will now receive a 0.06% increase in payments next year under your jurisdiction, Mr. Secretary.
Well,
This is up from 2.2%.
I mean, we're raising.
Without
was
objection.
proposed from the Biden administration. You are doubling the rate that the Biden.
The
that
gentlelady's
these
time has
criminally
expired.
investigated companies.
The gentlelady's time has
receiving.
expired. The chair now recognizes the gentleman from Michigan, Representative James, for 5 minutes of questioning.
Mr. Secretary, welcome. Thank you for your time and your service. I am grateful for you being here. We've gotten to have some real good conversations here today because when it comes to the health of this country, as has been said many times before, we do not have a health care system. We have a sick care system. I'm just going to jump directly to my questions here. In your time and in your research, do you have any objectives or any ideas on how to reverse the perverse incentives and some of the abuses that are happening with big companies and big government that are hurting people right now?
I mean, at every level of the system, there are, as you say, it's just a bundle of perverse incentives that encourage people that basically put every actor in the system, pharmaceutical companies, providers, hospitals, insurance companies, in a advantageous position if they increase the number of sick Americans and the level of our illness. And the way that we need to change that broadly is to realign the incentives so that people are getting paid to actually make people better. So we want outcome-based medical care. We want value-based medical care. We're working through the Center for Medical Intervention for CMI at CNN to explore a number of pilot projects that will do just that. And then we want to roll them out across the system. But we're looking for every opportunity, and I had meetings all this week, including with all the big insurance companies that will do exactly that. They want to do it too. They understand this is not what anybody wants. It's
And
not
we've
good
spoken
for
with insurance companies too, and that's a big issue. But another big issue in the United States is we are still treating all calories equal, and they should not be. Ultra-processed junk food doesn't stack up to the calorie from an apple or fresh Michigan produce. We all know that we need to step up and address the fact that ultra-processed foods drive obesity, heart disease, and diabetes. But in Congress, we're still tiptoeing around the fact that less than 10% of Americans even follow current guidelines. Current food system is poisoning poor people, and it's wrong. During this drives up costs in our healthcare system or sick care system, and it drives up our national debt. It's a national security issue. Are there any plans that you can share here today to address the food deserts in urban areas and rural areas across states like Michigan? You mentioned changing some incentives. Well, the leading areas before people get sick in the first place is a great place to do it.
Yes, Congressman, the first thing that we need to do is to recalibrate the dietary guidelines, and those are due in December. We got a 453-page document from the Biden administration that was just the product of the same kind of industry control that put Fruit Loops at the top of the food pyramid. And we're now going to give Americans a 4 or 5-page document that tells them what they should be looking for, particularly in their locality. And when we do that, it's going to drive good food. It's going to reduce the amount of processed food in our school lunch programs, in our military, in our hospitals, and other institutions. And it's going to drive good food. That's going to create markets for good food all over the country. And that's one of the ways we penetrate the food deserts.
Very good.
There's also programs under Medicaid to make sure that people in food deserts, on Indian reservations, in urban areas, et cetera, can get good food.
Very good. We absolutely have to take care of the poorest of the poor. We need to make sure that folks who deserve it can have support from us. Yesterday,
by the way, we're going to have the dietary guidelines out at least by August, so we're going to be months early, and I'm working with Brooke Rollins on that. And they're going to be very good.
The government being early on something, that's great. Secretary Kennedy, yesterday, you and CMS Administrator Oz secured an industry pledge to fix our broken prior authorization system. I hear stories from places like Flint, Michigan, where Dr. Bobby Mukamala sought prior authorization for full cancer screening after his patient's stage 1 tonsil cancer diagnosis so that he could determine the best treatment outcomes. When the patient finally received the PET scan 3 weeks later, the cancer had progressed to stage 2. These prior authorization reforms are critically necessary. What are you talking to industry folks about to hold them accountable for their pledges?
The largest companies in the industry, and I brought them all together, have now made the pledge to us yesterday that they're going to get rid of 80% of the prior authorizations. And they're also going to, make their systems interoperable. So it's much easier for a doctor to very quickly, before you leave the office, you should have that prior authorization.
The gentleman's time has expired. The chair now recognizes the gentleman from Massachusetts, Representative Auchincloss, for 5 minutes of questioning.
Good afternoon, Secretary. You've emphasized throughout your career concerns about corruption and conflicts of interest in healthcare, yes?
About corruption in healthcare?
Yes.
Yeah.
And you've pledged during your confirmation hearing and then again today, quote, radical transparency, yes?
Yes.
Yes. And you explained to my colleague from New York that you divested yourself, yes?
Yes.
And you fired the 17 members of ACIP because you think they have conflicts of interest, yes?
Yes.
And do you think that everybody within Health and Human Services at a senior level should hold themselves to a standard of radical transparency and divestment?
Well, I'm going to hold them to that standard, but
So not everybody should hold themselves to a standard of
yeah,
radical
everybody, and the OGE makes them all divest.
So everybody should divest and everybody should be radically transparent. Who works for you?
Yes.
Yes. And does that include people who have involvement in Health and Human Services policymaking, even if they're not in your department? Would you want them to be radically transparent as well?
I don't have any control over anybody except those in my department.
Well, I think you do. Let's talk, though, about how radically transparent you have been to date, because I want to ensure for the American public that they're getting what you pledged. Mr. Kelly Means is a special government employee. He's also a White House advisor. You know him well. He actually introduced you to Donald Trump. And he's the founder and the owner of TrueMed. Now, TrueMed is a company that sells saunas and supplements and maybe medical devices that you described to people using pre-tax dollars. And he has described his mission as routing federal funds away from health insurance programs towards these health savings accounts. Now, Mr. Means has tremendous influence over Medicare and Medicaid based on the executive order on Making America Healthy Again and the One Big Beautiful Bill, which both call for the expansion of HSA usage for these wellness and supplement products. So that's a direct revenue stream for his company while he's working in the government. So my question is, would you require Mr. Means to sign the financial disclosure forms that you're very familiar with?
I have no power to do that, but I find it interesting that you bring that up.
I'm going to reclaim my time.
Pharmaceutical companies have been in the White House for generations.
This is
none of you complain
my time,
about
Secretary, my time. Would you require, in keeping with radical transparency, that this individual who you're very close with, who has a major role in shaping MAHA agenda, and you have said so yourself publicly and many times, would you require him, before working on the MAHA agenda, that he sign those disclosure forms?
I have no power to require that. I can require people in my agency, and I've done that.
Will you continue to work with him if he does not sign those forms?
With
Mr. Means, will you continue working with him if he does not sign those forms?
I work with everybody, including all the pharmaceutical companies.
Do you think that he should respond to the letter that I wrote? Do you think that he should respond to the letter that I wrote requiring him, or asking him, I should say, to be transparent about potential conflicts of interest between TrueMed and CMS and the MAHA agenda? Is that something that he should do, in your opinion, in keeping with divestment? I mean, because you've said, sir.
You wrote me a letter?
He said, sir, you said before.
Are you saying you wrote me a letter?
I wrote Mr. Means a letter asking him to respond. Do you think he should respond?
That's between you and him. As I said, there's been pharmaceutical companies for generations in the White House, and nobody complained about it.
Secretary, you said that everybody who works on health policy should follow high standards of radical transparency and divestment. So I've asked him questions about whether he's done that. Should he, in keeping with what you just said at the top of this, should he be radically transparent?
Let me ask you this. Have you accepted $400,000 from pharmaceutical companies?
The reason you know that is because I have financial disclosure forms, and I'm asking him to submit the same thing. So should he do the same thing? Because when he doesn't, let's talk about what happened. Let's talk about Mr. Brad Smith.
Should you be prevented from accepting money from pharmaceutical companies? Because it says here you've accepted $400,000.
You asked Ms. Ocasio-Cortez, how did I do that when she talked about the higher rates given to the Medicare Advantage organizations? I actually have an answer for you. How did that happen? The answer is Mr. Brad Smith. So he was in charge of Doge Healthcare, and his biggest investors at his company, Main Street Health, are the Medicare Advantage organizations, the 5 biggest health insurance corporations in America. They're his investors. He owns this company. They own him. And while he was there, he set the rules and reimbursements for CMS to hook up his investors. So I'm going to answer the question that you asked Ms. Ocasio-Cortez. It is because of conflicts of interest. Do you think that CMS should continue to do business with Main Street Health under your watch? Is that radically transparent?
Are you saying that we should cut Medicare Advantage?
Do you think that Main Street Health should continue to do business with Medicare and Medicaid given the conflicts of
Are you
interest?
saying we should cut Medicare Advantage?
Mr. Kennedy, your dissembling and diversion distracts from the fact that you refuse to be radically transparent with
He
either
didn't give
Mr.
any
Eames or Mr. Smith. I'm going to
he-
enter for the record now documents
You didn't give any money to
substantiate these
United.
claims. Auchincloss oversight letters to Means and the Board of TrueMed and Main Street,
Without
Secretary's
objection,
all submitted.
the gentleman's time has expired. The chair now recognizes